Hello, everyone out here in YouTube world. My name is Beverly D, and I'm coming to you first time live on my channel. I've been coming across so many videos that is saying that YouTube is pushing out a lot of small channels now with content, and I say, well, listen, let me try and get out here and see exactly what this is all about. I really have a passion to help people select their health insurance policies. This is the new year, 2025. I have over 20 plus years of experience in the healthcare industry. I have a BS in health services management and a master's in public health with a concentration in health policy and management. So I'm very diverse in my knowledge when it comes to understanding how health insurance work and how you can pick a suitable policy for your your health needs. Listen, just giving advice, some tips and information based off of my background and my experience. I work with several payers and providers and patients. So I just want to come on to YouTube, try it out with everybody is saying of what YouTube is doing for small channels and just try to get my feet wet and see, is this really true what I'm hearing? And if it is, it's a good thing. And if it's not, listen, you could just say I learned something that I was able to apply to my personal life, professionally or personally, for a loved one or yourself. And I hope that it, serves you well. So let's get into it. When it comes to buying and selecting a health insurance plan for you, a lot of times people, I don't know why we are in this mindset that cheaper is better, right? So we look for the cheapest, lowest premium. And we select that without even realizing what we are doing when it's time to receive services, and we go to the doctors and have to get testing done, and then we're hit with these bills and we're not understanding because I thought I bought insurance policy and the insurance is just supposed to pay it out. But that's not how it works, guys. You have to really do some evaluation, basically more of you than the insurance. Because so you're going to always start out with, okay, do I have any health conditions, chronic diseases, or things that warrant me to see providers and specialists more often than normal? These are questions that you want to have already figured out before you choose a health insurance policy. And if you do not have chronic diseases and illnesses like cardiovascular disease, diabetes, things of that sort, and you do not have to go to the specialist or your provider's office, primary care office, more frequently, you also want to tune in and hear this information, because either way it's going to help you. So when you're selecting an insurance policy, especially starting in 2021, I think this is awesome that I'm able to provide this at this particular time. So we're in 2025, January 2025, and a lot of employers are sitting around your benefit packages, and you got to see if you're gonna remain with the policy or the carrier that you had previous years. You don't know if you're going to go with your spouse's option at their employer, or you don't know if you're just going to shop around on the marketplace. Either way, these tips are going to work for you, whether it's employer-based insurance, whether you're buying your own policy, a commercial plan, or in the on the marketplace. It does not matter. You want to apply this information either way. Okay, so when you're selecting your insurance policies, number one, you need to keep your personal medical history in mind. That needs to be at the forefront. Okay, so let's first tackle someone who has a chronic disease, who has a history of chronic diseases, or of cardiovascular disease, diabetes, or even cancer. That's going to require a lot of specialty testing and specialists being sought after, right? So you want to find a specialist that can treat your conditions effectively, right? So that's going to fall in the category of specialties, right? And specialization. That's not going to be like a general thing like that will fall underneath primary care, right? Preventative medicine, because we have surpassed that. We have been diagnosed, well, you have, or, this example with a chronic disease, so now you require treatment and you require follow-up, and that can consist of testing, seeing other specialists, determining the level of diagnosis that you have or condition that you have, and so it could be a long-term thing, right? And listen, thank God that guidelines had gone in previously, in the healthcare industry when you're dealing with insurance, or pre-existing conditions, and with that meaning that aligns with prior health, right? Health conditions, prior history, medical conditions. So some insurances has already implemented that pre-existing condition clause, right, to help cover some expenses. Now, years before, if there was a pre-existing condition, you would just flat out be denied to get the coverage. We don't know how long this is going to be, so we just want to make sure that you want to get in and get a suitable plan for you, right? So let's say I'm a person with a chronic disease, cardiovascular disease, diabetes, or cancer. When I go to look at my insurance policy, whether it's an existing policy or I want to choose a new one, you want to look at the areas that you will utilize the most, right? So if you have a chronic disease or a chronic condition, do not pick a plan based off of a low premium, because most likely it's low because it's for a person who will fall better in a category of preventative measures, right? So what's permitted? Going to preventative measures, prevention, going to your primary care. You don't have a chronic disease, so you just going for regular checkup, no serious diagnosing. You don't have to go less than a year, 6 to 12 months. You would just go yearly for your checkup and yearly for your examinations, just to stay, current. If with your health insurance, and with your stay current with your medical conditioning and keeping that routine. So those are what we call routine visits, when you go to your primary care office, and just getting your checkup, whether it's OBGYN, wherever you even go see a specialist. But if you went to a primary care office and you said to your, we call them a PCP, said to the PCP, listen, I'm having some problems in my chest. I don't know what it is. And they say, okay, well, let's send you to a cardiologist. Or if you go to the PCP and say, I'm having issues with my stomach and I don't know what it is, or swallowing, they say, well, let's send you, refer you to a gastroenterologist. Okay, so just know when you picking your policies, there are going to be out-of-pocket costs outside of the premium. So this is why it's not best just to pick a policy, a health insurance policy based off the lowest premium, because there are other out-of-pocket expenses that you will incur just from one visit. There can be up to 3 additional out-of-pocket costs in addition to the premium that must be paid by you just for one visit. Insane. But that's where we are in life, right? So, okay, go to the primary care office. Before you go to the primary care office, many insurance policies require a copayment. What is a copayment? A copayment is a payment that you must pay upfront before you can even see your provider. And that is determined by the policy that you choose. So a copayment can range from $10 to up to $100, depending on the level of care. So for a primary care office, it can range from $10 all the way up to $100 that you must pay. before you are even seen by that provider, right? So what would make it higher versus cheaper? Specialists. The specialist office, you have to understand, providers, they have they tell the insurance how much they charge, right? They tell the insurance how much it's going to cost for a patient or one of your members to come see me. They determine these charges. The insurance does not. The insurance do not determine what your doctor's office is going to charge to see you. Right? So if you go into a primary care office, it may be a different copay versus when you go into a specialist office. But a copay is a payment that you must pay up front before you even see your provider, right? Now, this is in addition to your premium. Okay, so you go to your provider's office and you say, okay, I'm having problems in my stomach or swallowing. And they say, okay, well, let's refer you to a gastroenterologist. You have to have a specialty, a specialized level of care on your insurance to say, okay, am I covered if I go see a specialist? Am I covered outside of the primary care office? You need to know that before you even proceed to that specialist office, to that gastroenterologist office. Why? Because if there is no level of coverage, that means this insurance is not paying anything. You are 100% responsible for any charge occurred for going to see that specialist, in addition to the premium. Okay, but let's say you have insurance. Okay, now you have to pay another copay to see this specialist. That can range from 10 to whatever X amount of dollars they want to range it from, right? Because again, the insurance, it would be on the insurance card, right? So most likely the insurance say when you go see a PCP, it can either be zero copay or it could be X amount of copay, dollars for copay, right? So let's say $50, right? They are already making you aware of that when you get your contract and when you get your insurance card, right? So let's see, do I have my insurance card? Let's just pull out an insurance card. So yes, I have my insurance card. So this is your insurance card. And on here, I'm going to just cover all of my information. But on here at the bottom, it shows the breakdown of everything, right? Of everything. So you cannot go to a doctor's office and say, oh, I wasn't aware, because they're going to say, let me see your insurance card. Oh, yeah. It says it right here. Right? Now, most doctor's offices, especially specialist office, will not see you without a copay. Will not see you without a copay. All right, so you do have a copay. You're ready to pay the copay to see the specialist. The specialist renders care services to you, and they say you have to do testing, and they may just come back and say it's something minor, such as acid reflux with the swallowing, right, or gas with within your stomach, right? But those services incurred charges. Okay, so this is where another out-of-pocket cost can be applied to you, in addition to your copay and in addition to paying your premium, your monthly premium. It is called a deductible. A deductible? I just thought I had a premium. Okay, now I got a copay and a deductible. Okay, yes. Some insurance policies can apply a deductible in addition to your copay. So what does that mean? A deductible has to be paid before the insurance will pay out anything towards your services that's being billed by that provider. So what does that mean? You go to the specialist, go to the GI, they submit a bill for $1,000. Everything for that day, for the consultation and for any testing and anything that was done, total $1,000. Well, your insurance is going to get the claim and then submit the bill back to you and saying this has been applied to your copay. So now you have $1,000 copay. Let's say $50 to $65. $1,000 deductible. $50 to $65 copay you had to pay in addition to your premium. That's a lot. That's a lot. So you could end up with that whole $1,000 bill have to be paid. That whole bill for $1,000 that must be paid by you before your insurance say I'm paying anything. Okay, so that's your second cost, out-of-pocket cost that you can incur. The third out-of-pocket cost you can incur is your coinsurance. Your coinsurance says that your insurance will pay your whatever service bill to them along with you. What does that mean? So you got that $1,000 bill. You satisfied now. Your copay your deductible could have been $500. It could be $5,000. Until that deductible is paid, every bill will be applied first to your deductible until that's met. Right? So you got to keep in mind, copay is always first to even get through the door to see your provider. Once you have seen your provider and services has been rendered, you can be hit with a deductible. Oh, they're going to say, well, that was part of the policy when you selected it. So this is why it's not good to just select a health insurance policy based off the lowest premium. Don't do that. So, okay, getting back, your deductible. So if your deductible was $500, $5,000, $1,000, any bill that comes through for medical services that you have received from any provider at any time, that deductible must be met first by you before your insurance can pay out. Okay, so the coinsurance. Your coinsurance says, okay, let's take that $1,000 that you met your $1,000 deductible prior to coming. You met it. Good. So now your insurance say, okay, that $1,000 medical bill from your provider's office was received. Of that, we're going to approve $900. We're going to allow $900 to be approved, and of the $900, we're only going to pay $250. And you're going to be responsible for, let's say $700. I'm sorry, not $700, $500. Let's say you're going to be responsible for $500 of that $900 allowable dollars, and they're only paying $250. So what's that? That's $750, right? The remaining could be written off. Like when the insurance says contractual write-off, that means that provider has agreed to accept what we allow and what you're going to pay and what they're going to pay, and the rest will be written off. You cannot charge this patient, right? So you have now a $500 co-insurance. You had to satisfy your $1,000 deductible, right? And you paid your $50 copay. These are all in addition to your low premium. This is why it's not best practices to select a health insurance policy based off of the lowest premium. I'm here to tell you, it's just not. I see a lot of patients that come in to doctors' offices and specialist office, and once they are seen, they get a bill. I didn't know all of this was I was going to have to be responsible for this. I don't know. And the first thing that I say and my coworkers say, well, did you talk to your insurance company? Because this is what your insurance company is saying that's applied to you, and what they're going to pay and what's not going to be paid. And all of this was based off of how you selected your insurance policy. If you know that you have chronic diseases, or if you're a person who have to see a specialist or have treatment and testing and other services done more regularly than normal or an average person, you want to look at the areas that you could get the most coverage, right? The most coverage and the least out-of-pocket expense applied. Right? And there are levels of coverage, and then there are maximizations of coverage. You can max out on that coverage and now be 100% responsible for those services. So I wanted to come on and provide some tidbits and information about selecting your health insurance policy in 2025, whether it's through your employer or whether it's through the marketplace. Now, when you go through your employer, it may be relatively cheaper if you are a single person, or if you're married, your spouse's policy. But do not just pick a policy based off a price of a premium. That is bad practice. It's going to come back in ways that you did not understand or foresee. So you want to take your time before you sign on a dollar line and start sending off your premiums. Is this the best policy that works for me? If not, think about it. My name is Bev D. You will be seeing me more talking about real life stuff when it comes to selecting health insurance policies for 2025. For now, see you later.